Brain abscess in children. Questions and answers.
What is the incidence rate of brain abscess?
The annual incidence of bacterial brain abscesses in children is 0.5 per 100,000 children.
What is the most common predisposing factor of a brain abscess in a child? A contiguous focus infection, bacteremia. Idiopathic. Neurosurgery. Immunodeficiency.
What is the most common cause of a brain abscess associated with a contagious focus of infection in a child?
Brain abscesses associated with a contiguous focus infection, for example, otitis media, mastoiditis or orbital cellulitis, are often caused by Streptococcus species, as well as anaerobic bacteria.
Can bacterial meningitis cause brain abscess?
Somewhat surprisingly, bacterial meningitis in children and adults is very rarely associated with brain abscess, despite the intense inflammation and bacterial load in the meninges covering the brain.
However, neonates with unusual gram-negative meningitis, caused by Citrobacter species very frequently, 85%, abscesses. What is the early capsule stage of a brain abscess? This early stage is commonly called cerebritis. After 2 to 3 weeks, necrosis and liquefaction occur, which is then covered by a distinct capsule consisting of an inner layer of granulation tissue, a middle collagenous layer, and an outer astroglial layer. Surrounding brain parenchyma is often edematous.
Where does an brain abscess develop?
It generally depends on the source of infection. Sinusitis, especially frontal, and otitis media and mastoiditis lead to abscesses in the parietal/temporal region.
What is the triad of brain abscess?
The classic clinical triad suggestive of brain abscess, fever, headache, and focal neurologic findings.
The classic clinical triad suggestive of brain abscess, fever, headache, and focal neurologic findings.
What is the difference between brain abscess and meningitis?
Whereas the child with possible acute bacterial meningitis requires prompt lumbar puncture for diagnosis, the most important initial study for diagnosis of brain abscess is cranial imaging.
Why is lumbar puncture contraindicated in brain abscess? Because of the risk of herniation from elevated intracranial pressure and because CSF is not likely to identify the infecting pathogen.
Identification of the causative organism is best attempted by obtaining culture through stereotactic aspiration of the abscess. Identification of the causative organism is best attempted by obtaining culture through stereotactic aspiration of the abscess. What is the indication of brain abscess surgery?
Neurosurgical intervention is generally undertaken in most patients with brain abscesses, both for etiologic diagnosis and reduction of lesion size.
Intravenous antimicrobial therapy should be given without delay to patients with a brain abscess. The empirical choice of agent should depend on the most likely organism.